I am currently the Post-Doctoral Academic Fellow here at the Skaggs School of Pharmacy. I graduated from our program in 2022. And if you've been following the AMA and some of the advertisements and posts that the CU social media has been posting, I am very interested in getting pharmacy students involved in research. I myself was very involved in research both during my pharmacy education and then now a different type of research in this current role. So again, I came to the Skaggs School of Pharmacy starting in 2018. Right off the bat, I knew that I didn't really want to be a traditional pharmacist. I was far more interested in getting that clinical knowledge that comes with a PharmD, but applying it to lab-based research projects. So I immediately was like looked for a mentor, looked at a couple of the different faculty profiles on our CU page, and was just really trying to identify somebody who was doing some interesting science. I found Dr. Tom Antrodoki who was doing a drug delivery formulation lab, but again, it was very basic sciences based. He was a PhD. He taught in our PharmD program, but he himself is not a pharmacist. And when I first started, it was pretty non-traditional and uncommon for pharmacy students to do bench-based research. But I really pushed for it. I tried to, again, explain that I feel like I would have a valuable insight to the lab as having that clinical background and really just wanted to gear myself to a career more towards that type of research. So I spent my 4 years in pharmacy school working in Dr. Anshidoki's lab, primarily almost being more of like a lab assistant. I did my own experiments. I went to lab meetings. I was a part of any conversations related to what are the next steps of the project. During my 4th year, during one of my 6-week rotations, I did 6 weeks full time in the lab working on a little offshoot of that project. And then when I graduated in 2022, again, I was like, I want to be a lab-based research pharmacist. So I stayed in Dr. Anshidoki's lab full time for a year. But unfortunately, if you have any lab-based research experience or any research experience at all, you might be familiar that science doesn't always go the way you intend it to go. And sometimes the project doesn't flesh out the way that we had hoped. So ultimately, I ended up leaving the lab-based project and going into this current role of an academic fellow. So as an academic fellow, I do more learning what it means to teach, learning how to be a faculty member, but also doing educational-based research. So I look more at, how do we improve outcomes in the classroom? The courses that I teach in are still very foundational sciences based. So I teach within pharmaceutics, pharmacokinetics, pharmacology, and really try to be that bridge between the basic sciences and the clinical sciences for especially those first year classes. But am always trying to find opportunities and students who are interested in pursuing whatever type of research they might be interested in, whether it is lab-based, educational, or clinical, which is the more common research route for pharmacy students and pharmacists. So again, clinical is more looking at the patient data, looking at outcomes of medication use and outcomes of, I did a clinical research project during pharmacy school where we were looking at penicillin allergic patients who were getting total hip replacements and whether they got a cephalosporin antibiotic or if they got a lesser tier antibiotic because there was concern of cross-reactivity for that allergy. So like looking at outcomes like that is more of the clinical research focus. Um, but yeah, so like, I mean, I have a lot of experience in both lab-based research, clinical, educational now. And again, just really excited that you all are here and possibly interested in pursuing more research-related careers and pathways. CU does not have a formal PharmD PhD pathway as of yet, although I do know that this is a continuous discussion that CU is having about possibly creating a more formal pathway. I kind of kickstarted some of that conversation when I started my labs and was taking some extra graduate courses because I thought it was interesting. And then I know that there are a couple other students who have followed in my footsteps, and we have a P4 student right now who will be pursuing her PhD here at CU in the lab that she worked in for all 4 years of pharmacy school. So again, it's not formal, but there are pathways in place and students who have followed down that path for, again, more of that lab-based focus type education and career. So with that, I'd love to open it up to all of you and just see what questions that you guys have about pharmacy school research, clinical, educational, lab-based.
And actually, I'll ask the first question because this is a question that I get sometimes out when I talk to prospective students. Uh, in your eyes, how do you feel about going just a PhD route versus a PharmD? If you're interested in research, how would you decide between the two?
So that is the question of the day, because then it's a question that, I ask myself a lot during the early parts of my pharmacy career. Like, am I in the right degree? Should I be going more for a PhD versus a PharmD? And I think it really depends on what are you hoping to get out of your education and what are you hoping to get out of your future career? If you have any interest in working with patients at all, even if it's something as small as like working directly with patients during clinical trials, or you want to be able to possibly have the option to work part-time at a clinic or a community pharmacy or a hospital-based pharmacy, then the PharmD is definitely where you need to be. A PhD very rarely will give you the opportunity to ever actually interact with those patients. From a pure research perspective, again, the PhD is the more traditional route for a research-focused career. Um, your PhD, most of that education is really, again, like the foundational sciences and critical thinking skills and how do I do research projects. And then you choose your topic of interest and you become the expert in that topic. Whereas the PharmD offers an opportunity to get the holistic understanding of the patient. You might find more of an interest in oncology, or you might find more of an interest in cardiology and do a research project related to that. But you still, as a trained pharmacist, have all of the information and all of the clinical knowledge that you get by being a pharmacist that you can apply to those lab-based or clinical-based projects. Thinking about careers again, if again, you're hoping to be an ICU pharmacist, but you're really, really interested in still having some version of research within your practice, that clinical research is almost, I would argue, a guarantee in a lot of those higher tier pharmacy practices. So again, like ICU pharmacy, oncology pharmacy, because um, you have all this patient data. You're doing so many different interventions to those patients. So you're going to do clinical research projects. I would argue that probably the majority of the clinical pharmacists that are on our faculty at CU are published authors on manuscripts related to different research projects within their field. So you have a lot of different mentors if that is that's the career path you're more interested in going of patient care with a research specialty. That's an option. As far as like, I don't really want to touch patients. I have no desire to be around patients. Like, I want to help promote better patient outcomes and I want to be involved in the healthcare system, but I don't necessarily see myself being the one that's actually working one-on-one with the patients. Instead, I want to be the one working on preclinical projects, or I want to be the one taking blood samples from clinical trials. The pharmacy degree still offers you the opportunity to do that. We have several faculty members who are PharmD trained, who then after graduation, instead of getting a residency or instead of getting a job in a hospital, they went on for research focused fellowships. So they got more training in lab-based critical thinking analysis that if they had done the PhD route, they might have gotten a lot of that already, but now they have that clinical pharmacy background, that fellowship training for research within their field, and now they're running labs and they're running clinical trials. So I guess back to that original question, PhD versus PharmD, it's truly to me, what level of patient care are you hoping to be involved in? What level of flexibility do you want in your career? With PhDs, it's pretty like you are doing research for the majority of your career, whether that's running a lab, whether it's working in industry, versus pharmacy. The PharmD opens so many doors and so many opportunities, both within clinic and within industry and within government practice as well. So working for the NIH, working for the CDC, FDA, regulatory work, all of that can have research components and are available to you as a PharmD. I hope that answers
Thank
your
you.
question, Noah. Very, very
Yes,
long-winded, but
it does. Thank you.
what other
So,
questions do you all have?
yeah. And it can be, it doesn't have to be specifically about Dr. Rico's like research. She was also a student in our program, and now she works for the school. So it can be about that experience as well.
I think one of the questions that I do get a lot from interested students who are like, I don't even know where to start. Like, how do I even start doing research as a pharmacy student? I think really my big piece of advice is just like look out for someone who could be a good mentor for you. Look out for somebody who you seem to have shared interests with, whether that's within the disease state, like you have a faculty member who's teaching you about a really interesting uh, disease state or really interesting lab-based practice that they do, and you just want to learn more about it. I had mentioned that in the past, it wasn't very typical for pharmacy students to work in labs. I would still say that it's probably not the most common research path for our pharmacy students, but if you are someone who is more like me, who is more like Anna Figueroa, who is that fourth year student who's going on to do her PhD, and you're like, I want to do this very research focused career, then our faculty are very open to helping you get the experiences you need to be successful, to prepare you for that career. Um, we have for clinical research, so again, more of that patient data. What's really nice about clinical research, and I always joke that you can do a clinical research project from your pajamas at 11 p.m. on a Friday night with a glass of wine, if you so desired, because it's more flexible. You're not tied to a lab because you're running this experiment and this machine is only available from this time to this time. So the clinical-based research is a little bit more available, especially since the majority, not all, especially within your first year, this isn't exactly true, but within your second, third, and fourth year, especially, most of the faculty members and preceptors that you're going to be working with are clinical pharmacists who likely have some clinical research experience and might be great mentors for you for doing more of that clinical research related career-based experiences. We also have the honors program at CU, which is a more formalized pathway of doing research. Again, whether it's educational, clinical, or lab-based, you would apply for it within your, I believe it's your second or third year, or your end of your first year. You identify yourself a mentor, you develop a project. And the way the honors program works is really just you have specific meeting times throughout the year where it's like, we expect you to come and present to us the progress you've made so far. Um, I don't remember the number off the top of my head. I want to tell you, I think the expectation is 400 hours is supposed to generally go into that research project for the honors research program. A lot of students tend to use one of their elective rotations in the P4 year to dedicate a big chunk of time of getting the brunt of the project and the analysis done. And then if you complete the honors program, then you graduate with honors on your transcript, which is really nice to have, but it's not necessary to do research. You can do research without being involved in the honors program. You just find your mentor and you work with them about what plan you want to have in place um, to pursue the project and really just identify what the expectations are. You know, is the expectation that you just want to learn some basic lab skills? Is the expectation like I really want to be on a publication for a high impact journal related to diabetes care? Really just setting those expectations, again, finding that mentor that meets your interests and your passions. And nobody is expecting you to come into pharmacy school knowing exactly what you want to do with your career. That's an unfair ask to have for any of you. Um, Even myself, who, you know, thought they knew exactly what they wanted to do, what I wanted to do, like my first day of pharmacy school. If you told me even 2 years ago that this is where I would be sitting, I'd say absolutely not. There's no way. Um, but just to kind of get an idea of like what is it that excites you? What is it that interests you? And what is it about pharmacy in particular that brought you to this webinar, that brought you even interested in pharmacy school to begin with? Any questions at all?
Hi.
Hi.
I think my main question is what are the particular areas of research that the university is interested in, or what are your strengths as Colorado University that like the research that you're particularly out there with? Because like I've been in communication with schools like University of Wisconsin and Madison, and I know that they have like research into psychedelic substances and about, development of psychedelic substances into treatment and services. So I'm more interested in that section.
Yeah, absolutely. Great question. And it's a little bit of a difficult question because our faculty is so broad. At the University of Colorado, we don't necessarily have like, we are renowned for our diabetes research. That said, we have researchers within, I would argue, most fields of your interest. So you mentioned your interest in psychedelics. I can think off the top of my head, oh, Dr. Jacqueline Bainbridge is who I would point you in the direction to talk to. She is a neurology-based pharmacist who does clinical trials relating to marijuana, psychedelic mushrooms, specifically within the PTSD and anxiety related pathologies. So I would say, with thinking about lab-based research, one of our bigger areas of, I guess, grant funding is one way that we can think about what are our big research areas is our Center for Drug Discovery. So there's only a handful of these like major centers throughout the nation, and Colorado, actually specifically the School of Pharmacy houses one of those centers. So Dr. Dan LaBarbera is the director of that center. He is a PhD, so not a pharmacist. However, he teaches within the pharmacy program. He is very involved in the training of our pharmacy students. He has graduate students in his lab. So again, like the drug discovery, looking at the what's the word I want? Like the medicinal chemistry, the drug structure, and then from there, finding hits to be able to create new therapeutics. And he gets collaborations from the School of Medicine, from the School of like everywhere across the nation who are sending in these compounds that they're looking to investigate as possible therapeutics. So Center for Drug Discovery is a big one that I would say Colorado is pretty renowned for. In our clinical side, I mean, a lot of our faculty are publishing on major national guidelines. So Dr. Joe Sassine, Dr. Robert Page are in the cardiology space, and both of them are authors on the American Cardiology Association, American Heart Association guidelines that you as students, and not just you, but students across all of the United States are learning to follow for treatment of heart disease, hypertension, dyslipidemia, and the like. So they have a lot of really robust research, clinical research related to that field. Again, I'm like thinking of like what other like big research labs do we have? I mean, we have a lot of faculty who are interested in looking at drug-drug interactions and HIV drug preparations in particular. So I'm thinking Dr. Christina Brooks is a PharmD she was one of those PharmDs who doesn't necessarily work one-on-one with patients, but did some NIH fellowship training in pharmacokinetics. So she looks at more of like a translational lab of how can I make different uh, formulations for HIV for pregnant women? Like how can I protect the baby while also treating the mother and making sure that the mother is safe? So it would really come down to like if you had a particular interest, like let let someone in the School of Pharmacy know and we'll find you a mentor to reach out to. And if they don't know someone, that's really the beauty of pharmacy of we will or if they don't have anything, they will know someone who will. We have a lot of collaborations with the School of Medicine on campus. So I don't know if you've been to the Anschutz Medical Campus, but what's really unique about us is that there are three hospitals on campus. We have the Children's Hospital, the University of Colorado Hospital, and the Veterans Affairs Hospital, the VA. Um, and this entire campus is purely health professions related graduate and professional students. So nursing, MDs, PT, I'm like, I know I always miss dental. There's like any major health related profession you can think of like is likely on this campus. And then all of our graduate students as well. So like again, the people who are interested in master's and PhD, all of those degrees are related to healthcare in some way. So pharmaceutical sciences, toxicology, cancer biology. That's what this campus is all about. So all of the research that's happening on this campus is related in some way to healthcare. I hope that answered your question. Again, it's not like the greatest answer because it's not like we have like this is what we're renowned for. But we just have a very varied interests within our school.
Actually, that was a great answer. I think everything is like you laid it out perfectly with everything that's on offer and the different professors who work on different things. So thank you for that. I think my follow-up question would be in terms of research, what would you say that Colorado University does that other pharmacy schools do not? What is what's innovative that they have to offer?
That's a great question. And I think it does, again, just come down to the level of collaboration that we have, both within our school and within, again, these other schools on our campus. So the medical school, the imaging centers, and again, this access to three different hospitals. So a lot of the both the patient data, but even for the lab-based related projects, patient samples are coming directly from patients that are being treated on our campuses, on this campus, or within other UCH related hospitals that are spread around the Colorado system. So I would say it's extremely rare to see a publication come out of our School of Pharmacy that doesn't include multiple authors from multiple professions and multiple different schools or fields. Or when I say schools, I'm referring specifically to like Anschutz Medical Campus, but we also collaborate with other universities. So that Center for Drug Discovery, I said, was one of a handful that are spread around the nation. So we have a lot of collaboration with universities who don't otherwise have access to the technologies and supercomputers that we have upstairs that are doing all of that analysis. So we really do pride ourselves on our collaboration, and I'm laughing a little bit because we at the School of Pharmacy we have this thing called Culture by Design, where we have these 24 fundamentals that the school upholds as like this is what we're all about. And this week's fundamental was collaboration, and I actually wrote up the email for this week to talk about the collaboration within the school. So I do feel really strongly about that. That's really kind of what helps. That's what stands out to me as a research institute, as an educational institute as well. That it, like it extends beyond just research, but definitely within research.
Thank you
Of
so much.
course.
And I think my last question would have to be around funding. I don't know if you are able to answer that, like about the funding for research and does it extend to funding for, you know, your overall studies as a pharmacy student and the opportunities in that area. Is there anything you can discuss or let us know about that?
Yeah, absolutely. It's a complicated question given the timing right now. I'm not sure if you've heard about the NIH funding cuts that are happening at the executive level, but that's affecting nationwide. So I'll start with that and just say that, you know, University of Colorado has traditionally been a top NIH funded university. And the School of Pharmacy in particular has been one of the top funded NIH pharmacy schools within the country. Um, with these budget cuts at, again, the executive government level to the NIH, our school and again, other schools in the country are in very careful conversation with the NIH, with the federal government about how can we balance that funding. And what's been really pleasant to me is that we get an email from like the chancellor's office and the university usually several times a week, just giving us updates on this is where we're at with this conversation. We're still talking about this. Like, we're here to support you. Keep doing your research. Like, we're here again. So that collaboration type of conversation, like we want to keep being a research focused university. Um, However, just like at any pharmacy school at any university in the nation, all of that NIH funding is a little uncertain at the moment. That is not specific to Colorado. As far as funding for students go related to research, if you get on a project that has funding that is able to pay you, you can get paid for your research. So when I did research with Dr. Enchidoki, I was paid, an hourly wage for the hours that I worked in the lab. Um, if you do the honors program, I will say you can't get paid for that work just because you're getting like school credit for it and it's considered double dipping and that gets a little bit complicated. But there are some funding opportunities for students doing research. It's not 100%. And again, with all these NIH uncertainties, it wouldn't surprise me if we're not offering that to our pharmacy students as much as we might have, just again with labs trying to protect their funding. But that's not, I can't say that like 100% of the time. Um, we don't necessarily have scholarships specific to research. However, this university, the School of Pharmacy does offer a lot of scholarships to our students, and I applied to several of them talking about, my interest in being non-traditional, my interest in research, and I was awarded scholarships based on my interest in doing research. It was considered, unique enough, diverse enough to warrant that scholarship award. Um, so yeah, there's no like true like, oh yeah, there's this like research scholarship. Here's this research funding for pharmacy students. It's more of if this is the path you're interested in going down, your mentors and the school will do what they can to help find you the opportunities to get compensated in that way.
Thank you so much. I think that's all the questions I had. Thank
Perfect.
you.
No, thank you for asking. Great questions. What other questions does anyone else might have?
And so some of those questions that you asked were the questions that I was going to ask too. And so thanks for asking those.
Trying to like think of like what else can I talk about here for just opportunity. Again, I mean, you don't have to get involved your very first year. I think a lot of the times most faculty members actually want you to take a step back. Let's get used to the pharmacy school curriculum for at least a couple weeks, maybe a couple months, maybe for the whole first semester before we are going to bring you into these projects. But that gives you time to settle in, figure out what it is I want to do. But again, if you are coming in like I did, I like to joke around with Dr. Enchidoki, who was my PI for that lab, has become such a mentor for me and is now like I call him like my second dad at the university. Um, that I just kind of kept emailing him and followed him around and said, no, 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 like I really want to start doing research with you. Like, trust me, I'm very passionate about this. And he took a chance on hiring this New Yorker who was interested in his lab. And I really do think it changed a lot of the culture related to getting pharmacy students into specifically our basic sciences labs. Again, there's never been a problem with getting our pharmacy students with our clinical research projects because that's the majority of our clinical pharmacy faculty. But we have seen a really interesting increase in interest for lab-based research projects or non-traditional pharmacy paths. And I, in particular, like that's my hill to die on of I want to get students involved in these non-traditional paths, get students involved in research, whether it's clinical, lab-based, educational, um, because I think it just overall makes you a better pharmacist. Any research is going to develop critical thinking skills. It's going to develop, um, you know, problem solving skills that, you may or may not get from your day-to-day life and the general curriculum. And it allows you to develop yourself as a more prepared professional for whatever career path you are desiring to go down.
I thought of another question. So you mentioned a few times that you don't need a specific area to be interested in coming into the program, and nor do you need a research background. But many of the prospective students that we work with are, they have a year or two before they would even start our program. Is there something that you would recommend if someone is interested in research? Is there something that you would recommend or something that you did that prepared you well for um, uh, postgraduate work and research?
Yeah, absolutely. And I think my biggest piece of advice is to hop on PubMed and just kind of see what has been published recently, especially if you do have even a mild interest in any specific disease area of infectious disease, or I want to learn more about the COVID vaccines, or just and reading some of those scientific papers that come out. The more comfortable you are reading and analyzing those papers, the stronger you're going to be as a candidate for a lab. And just being prepared to write up your own paper, to write up your own experiment. So I would just say like, yeah, reading up on some of the scientific literature. If there's a faculty member in particular that you're interested in maybe talking to and working with or getting to learn a little bit more about. So the School of Pharmacy has like their faculty profiles page, and you can click on a couple of different faculty members and just read their research interest blog. Um, and then search their name in PubMed or Google Scholar or whatever that you may use to find your scientific literature, and learn more about what their lab is doing. And see if it does sound like something that you are interested in. And really also think, is it something that and this is again geared towards more anyone who's interested in lab-based projects, is it something that you as a clinical pharmacy student could is offer to a very basic sciences focused lab? Like where can you, when you're reading the introduction and you're reading their discussion and their conclusions, where could you see yourself adding a twist of a focus on patient care, a focus on um, the actual impact that it's going to cause for patient health outcomes? Um, Otherwise, I think like truly my biggest piece of advice for preparing for pharmacy school is to just enjoy your time before pharmacy school. Pharmacy school is a lot of fun and it's great, but it is a lot of work. It's a professional program. So I've had some prospective students who were like, I want to like I want to know what courses are taking in the first semester so I could pre-study. And I really think that that is not a good piece of advice, because I truly believe our curriculum is going to prepare you for success. And there's just not a need to, dive in too deep right off the bat. Enjoy the scenery, enjoy the ride. You'll get to your destination, and you're never going to expect which twists and turns come along the way. Like I said, if you had told me 2 years ago that I wouldn't be in a lab and I would be teaching these foundational science courses to pharmacy students and doing educational based research, I wouldn't have believed you. But keeping your doors open and your options open, and just being willing to consider other career paths within pharmacy that you just didn't even know existed.
Excellent advice. Okay, are there any questions out there that we only have a few more minutes, so this is your last chance.
And if you do think of any questions after this call, like please feel free to send me an email. I think if you just Google my name with CU Pharmacy, like my page will pop up that has my email, which is just madison.rico@CU Anschutz. And I'd be happy to talk to you more about, your interests, like can CU provide what you're looking for within a pharmacy school for both research and different curricular outcomes that you might be interested in having. I mean, like I mentioned and Noah mentioned, I was a student here, so I've seen it now from both the student perspective and from this faculty side, and it's been um, really interesting just like putting those two perspectives together and really seeing exactly what we're doing to help student success. Um, or again, if you're just interested in like, is anyone doing this type of research on campus? And I could do some looking around to see if there is anybody that I can think of who's doing a particular type of research. I think there's a lot of areas where I immediately am like, oh, like I think it was Terrence who said like, oh, I'm interested in psychedelics, and I was like, Jackie Bainbridge was the first person that came to mind. And there's definitely going to be some areas that act like that. And there might be some that I'm like, oh, I don't really know. Let me see who I can talk to and who I can match you with to possibly find you a mentor, because pharmacy is a really small world and that extends beyond just pharmacists, but also pharmacy education. So the PhDs and the labs that are involved in training our pharmacy students as well.
Okay. Thank you so much. Oh, do we have any question? Anytime I see movement in
It's like, oh,
the,
do you have a
do you have
question?
a
Yeah.
question? If you don't, that's okay. Okay. Well, thank you all for attending. And like Dr. Rico said, if you have anything along the way, I know she is very generous of her time. So, and I know anytime I have a question or any other staff member have questions, yeah, Madison is one of our
One of the
best
go-tos.
best contacts. So yeah, if you have any questions along the way, I'm I'm here for you if you have questions about the program, about application stuff. I can help you if you're applying right now or if you're applying in the future. So let me know. You will be getting emails from me, and you probably already have emails from me. So ask me any questions about that, and then research, you go to Dr. Rico. So thank you all for attending, and be on the lookout for follow-up communication from us. Okay.
Thanks, everybody. Have a great rest of your day.